Mental health is one of the most significant public health challenges of our time, yet it remains shrouded in stigma and misunderstanding. The World Health Organization estimates that 1 in 4 people will experience a mental health condition in their lifetime, a quarter of the global population. This is not just a statistic, it's a wave of human suffering that affects friends, family, colleagues, and ourselves. Even before the pandemic, nearly 1 billion people were living with a mental disorder, and that number has only grown. The COVID-19 pandemic amplified anxiety, isolation, and grief, overwhelming already fragile mental health care systems. The demand for help now far outpaces available resources, leaving millions without care. This is known as the treatment gap. Even in wealthy nations, mental health services are underfunded, with most countries allocating less than 2% of their healthcare budgets. In high-income countries, only about 23% of people with depression receive adequate treatment. In lower-income nations, it's just 3%. Untreated mental illness impacts work, relationships, and entire communities. We need new solutions. Traditional models alone can't keep up. The scale of the problem demands innovation, breaking down barriers of cost and accessibility. Technology, once seen as a source of anxiety, is now emerging as a powerful ally in our journey toward better mental wellness. It's time to rethink how we deliver support and meet people where they are. In response to the mental health crisis, AI therapy apps have emerged as digital tools offering immediate, personalized support, right from your smartphone. These apps provide guided meditation, mood tracking, and interactive conversations that simulate therapeutic dialogue. Their goal: make mental health support radically more accessible, breaking down barriers of cost, logistics, and stigma. Many are low-cost or free, available 24/7, and offer anonymity that encourages people to open up. There are 2 main types of AI chatbots: rule-based, which follow scripts designed by mental health experts, and generative AI, powered by large language models like ChatGPT. Rule-based bots guide users through proven techniques but can feel repetitive. Generative AI chatbots create dynamic, human-like conversations, helping users reframe thoughts and explore feelings in real time. These generative models have shown greater effectiveness in reducing psychological distress compared to rule-based bots. AI therapy apps are not a replacement for traditional care, but they offer a vital first line of support for millions. The technology is evolving rapidly, opening new possibilities for mental health support. Let's look at 2 real-world examples: Wyza and ChatGPT. Wyza, launched in 2015, uses a friendly penguin avatar to create a safe, non-judgmental space for users. It guides people through evidence-based techniques, from cognitive behavioral therapy and meditation, helping manage depression and anxiety. Wyza's commitment to safety is notable. It partnered with the UK's NHS and features a clinically audited SOS button that connects users in crisis to emergency help. Studies show Wyza users see significant improvements in depression and anxiety symptoms. On the other hand, ChatGPT, while not designed for mental health, is increasingly used for emotional support. Its advanced language capabilities help users process feelings, reframe problems, and even role-play difficult conversations. The appeal of generative AI like ChatGPT lies in its flexibility and conversational depth, offering creative support beyond scripted responses. People are seeking digital companions that are patient, non-judgmental, and able to engage with the complexities of their inner lives. These tools demonstrate a growing demand for accessible, empathetic digital support. Virtual reality, or VR, is transforming mental health care by creating immersive, controlled environments for treatment. VR is especially effective for exposure therapy, helping people confront fears, like flying or public speaking, in a safe, simulated setting. Therapists can adjust the intensity of these experiences in real time, ensuring patients are challenged but not overwhelmed. For veterans with PTSD, VR recreates traumatic environments, allowing them to process memories with clinical support. VR is also used for mindfulness and relaxation, placing users in tranquil virtual worlds that reduce stress and anxiety. These immersive experiences can be more effective than traditional methods for some individuals. VR even offers social environments for practicing social skills without real-world judgment. It's not an escape from reality, but a powerful new way to engage with it and heal. The promise of AI and VR is their ability to democratize mental health care, making support more accessible than ever. Immediate 24/7 access means help is available whenever it's needed. No waiting lists, no appointments. Digital tools eliminate geographical barriers. Anyone with a smartphone and internet can access support. Many apps are free or low cost, making them a viable first step for those who can't afford traditional therapy. These technologies also help combat stigma by offering anonymity, encouraging people to open up without fear of judgment. Users often feel safer sharing vulnerabilities with an AI, making it easier to seek help. Personalization is another key benefit. AI apps track mood, learn triggers, and tailor suggestions to individual needs. VR treatments can be customized to specific phobias and comfort levels. This personalized approach empowers users to take charge of their mental health journey. Technology is making support more relevant, effective, and inclusive. It's a step towards a world where mental health care is a right, not a privilege. The barriers of cost, location, and stigma are finally being broken down. Despite their promise, these technologies come with serious risks and ethical dilemmas. The lack of regulation means not all AI tools are safe. Some have given dangerous advice or failed to recognize users in crisis, with tragic consequences. Data privacy is a major concern. Many mental health apps aren't covered by strict medical privacy laws, leaving sensitive information vulnerable. Some apps share user data with third parties without clear consent, and data retention policies are inconsistent. AI can simulate empathy, but it doesn't truly understand or feel compassion. This can leave users feeling dismissed in moments of deep distress. The business models behind these apps also raise questions about sustainability. Helpful tools can disappear overnight due to financial pressures. We must demand robust safeguards, transparent data practices, and clear accountability. Technology should never put profit above user well-being. The limitations of AI, its inability to genuinely empathize or take responsibility, mean it can never fully replace human care. Ethical oversight and regulation are essential to ensure these tools help, not harm. As we embrace innovation, we must also protect the vulnerable. The future of mental health support depends on getting this balance right. Proceeding with caution is not just wise, it's necessary. AI therapy apps are not a replacement for human therapists. They're a different kind of support. Human therapists bring empathy, intuition, and deep understanding that technology can't replicate. Therapy is built on trust, connection, and professional accountability, qualities unique to humans. Therapists can read subtle cues, adapt strategies, and provide long-term personalized care. AI lacks memory, responsibility, and the ability to form a true therapeutic alliance. The healing power of therapy comes from being truly seen and understood by another person. Technology can augment therapy, offering support between sessions and handling routine tasks. But it cannot replace the transformative connection of human care. The future is not a competition between AI and therapists. It's about collaboration. The human element will always be at the heart of mental wellness. The best way to view AI and digital tools is as a complement to traditional care, not a replacement. For those hesitant about therapy, AI chatbots offer a low-stakes introduction to mental health concepts and self-care. These tools can bridge the gap, helping people take the first step toward seeking professional help. For those already in therapy, AI apps reinforce skills and provide support between sessions, making care more continuous. Therapists can use AI for initial screenings and routine check-ins, freeing up time for complex cases. This blended model stretches resources and improves outcomes. Platforms like Wiza are already combining AI with human support, offering the best of both worlds. Technology and humanity together create a stronger, more resilient safety net. The future of mental health care is a hybrid model, blending human expertise with technological innovation. Imagine a world where digital tools monitor your well-being, offer proactive support, and seamlessly connect you to human therapists when needed. Therapists, with your permission, could use app data to better understand your patterns and triggers, making sessions more focused and effective. Technology would handle data and routine support, while humans provide wisdom, empathy, and deep connection. To build this future, we need robust regulation, strong privacy standards, and ongoing scientific validation. The goal: a comprehensive ecosystem where technology and humanity work in concert. By embracing a hybrid model, we can close the treatment gap and make quality mental health support a universal right. The next chapter of mental wellness is one we write together, humans and technology side by side.